Good evening. Thank you all for finding time and joining today's webinar. My name is Dwani Karya, and it gives me immense pleasure to be your host today. Ladies and gentlemen, I will quickly go through some points to note so we all have a seamless webinar experience. During the course of this webinar, please communicate in the chat box. We will be addressing your questions during the end of the panel discussion, and we will leave time for an insightful question and answer session. So do send in your queries, your questions on the chat box. Ladies and gentlemen, in case of any technical issues, please give me a signal in the chat box. We will try and help your queries and resolve it as quickly as we can. In today's webinar, we will be discussing and understanding the role of nutrition in diabetes management from an esteemed panel of doctors. Diabetes, ladies and gentlemen, is a condition characterized by frequently elevated blood sugar levels. Over the last 3 decades, diabetes has gradually increased in India and around the world. India is also facing a tsunami of diabetes, having the second highest population with diabetes in the world. With our current lifestyle, a healthy eating plate not only helps us control our portion sizes, but also emphasizes on choosing healthy carbs over unhealthy carbs to prevent blood sugar levels from spiking. To furthermore understand the do's and don'ts, let us learn them directly from our experts. Today's speakers, ladies and gentlemen, are really, we are honored to have them right here with us. So please help me in welcoming Dr. Amit Kumar De, consultant diabetologist, Apollo Sugar Clinics, joining us from Kolkata. Very, very warm welcome to you, sir. We have Dr. Balaji Jagan Mohan, consultant diabetologist, Apollo Sugar Clinics, joining us from Bangalore. Well, welcome to you, sir. Joining us, we have Dr. Anish Bale, senior consultant endocrinologist and diabetologist, Apollo Sugar Clinics, joining us from Mysore. Well, welcome to you. We have here with us Dr. Soumya SL, consultant endocrinologist, Apollo Sugar Clinics, joining us from Trichy. Welcome, ma'am. And we have here with us Dr. Naveen Gupta, Head Medical Affairs, Unilever Health Sciences, Hindustan Unilever Limited, joining us from Mumbai. Once again, a very, very warm welcome to this esteemed panel, of experts, our doctors. It's truly an honor to have you all together here in this panel discussion. Ladies and gentlemen, also let me tell you that we are, going to discuss a lot of topics in this panel discussion, taking from fiber gap in India, symptoms to look for, battling obesity, and, discussing some specific symptoms as well. We'll also be throwing some light on weight loss strategies. And of course, a lot of people are dealing with a lot of lifestyle management issues, what to have, what not to have, controlling the hunger pangs, and, a lot of other things related to healthy platter. So I'll be starting with the panel discussion, and I'll be throwing in my first question to Dr. Amit Kumar De. So I wanted to ask you, let us quickly begin with a discussion by first understanding the causes of diabetes and what symptoms we can look for quick precautions. Like, can you shed some light on it, like about the quick precautions and what are the symptoms we can look for?
Good evening, everyone. And like you rightly said in the introduction that we are going through a tsunami of diabetes. We call this a metabolic epidemic. Now, diabetes, as we know, is a chronic metabolic condition, and it encompasses a variety of symptoms. The most important thing to understand about diabetes is that in the earlier stages of diabetes, it's a silent disease. And by the time the symptoms develop, it has already progressed into an overt clinical condition. Therefore, we should not always wait for symptoms and signs to appear, but screening plays a very important role. We must remember that all Indians or Asians by our ethnic origin are at a high risk of getting diabetes. Therefore, screening is a very important tool to find out whether one is at risk of developing pre-diabetes or diabetes. And if actions are taken in the right time, then diabetes can definitely be prevented, and also the complications can be curbed. There is also one more issue in our current scenario, is that obesity plays a very important role. Diabetes and obesity combined together is known as diabesity. Indian patients often are known as thin fat people, where they have a central obesity, they have got a belly fat. And that kind of gives them an increased risk of developing diabetes because of insulin resistance. So what is insulin resistance? It's a condition where insulin is produced in your body, but it is unable to act on the cells. And that predisposes a large section of our population who are overweight or obese towards the risk of diabetes. This is, of course, added by our sedentary lifestyle and more digitalization, use of technology. All that is good for us for convenience, but it does push us towards metabolic diseases and an epidemic like diabetes. And as I said earlier, that being a chronic metabolic disease, regular follow-ups and a continuous monitoring and care is the only way out in curbing this disease. That is why we have Apollo Sugar that comes up with regular lifestyle management plans that helps our patient, and it has helped our patients over many years. Many patients have benefited from these programs in getting their blood sugar levels, their HbA1c under control. Diabetes is a disease that can definitely be prevented, and the complications can be treated and addressed.
Thank you so much, Doctor. And thank you for telling us the importance of how obesity is related to diabetes and how care should be taken. I would like to ask my next question to Dr. Balaji Jaganmohan. Sir, in case of obesity as a symptom, as we were discussing earlier with Sir, it's a symptom of diabetes and a very important one that too. So what can we start doing regularly in order to reach the weight loss goals? Because as Sir rightly mentioned, like when it comes to Indian structure, the main center point is that is the belly button, that area is like very, very obese. And sometimes, a lot of men especially go through that. So could you throw light on that as well, Sir?
So like Dr. Amit has pointed out, the concern with Indians per se is they are having this abdominal obesity. In fact, they have arms and legs that are much thinner if you have to compare them with the Caucasian or the African counterparts. So what happens because of this abdominal fat? There is a lot of insulin resistance, and because of this insulin resistance, the sugars are not being taken up into the tissues and utilized for energy. Now, what are the things that we need to be watchful about if you're obese? If you're obese, you have to follow a good diet and you have to exercise regularly. Now, talking about diet has to be low in calories, it has to be low in glycemic index, and also the portion size of that particular meal is important. So if a person is consuming a diet which is larger in quantities, or if the glycemic index is high, and if also the fat content in that diet is high, then that increases the likelihood for that person to gain weight, or it is difficult for that person to lose weight. Other thing is that people who are obese, or if they are overweight, it is important for them to exercise regularly. Now, when we talk about exercise, an individual should exercise at least 150 minutes per week. That translates roughly into 30 minutes of exercise for at least 5 days in a week. And also there's something called an ideal body weight. So if you take a look at the height of an individual in centimeters, the last two digits translates into the ideal body weight. So for example, if a person is around 175 centimeters, 75 kilograms would be the ideal body weight. So if you can maintain your body weight in that range, then you can kind of keep obesity at bay, you can prevent insulin resistance, and you can prevent other metabolic diseases like diabetes, hypertension, high cholesterol levels. So the two main things that an obese individual or an overweight individual needs to do is follow a good diet that is low in calories and low in glycemic index, Also, fiber content should be high. I think that we will talk about in the next questions. And exercise regularly so that we can maintain an ideal body weight.
Thank you so much, Doctor, for highlighting those two very important points. Along with a proper diet, there has to be at least a 30-minute workout or exercise regularly, to control the obesity, to control the weight. And according to your height, your weight has to be, appropriate and should match the height that you have. Thank you so much for answering that. Which leads me to my next question, which I would like to direct to Dr. Anish Bail. So talking further about obesity, because it's one of the most important, symptom of diabetes, what are the weight loss strategies that can be adapted during diabetes, especially for people who follow a very hectic schedule and a very busy lifestyle?
Oh, sorry for that. Now, what has happened is over the last few decades, there has been a dramatic change in the dietary pattern of most of, I would say, Indians. We've been consuming food which is very rich in calories, which has more amount of simple sugars, more amount of fat in it, lesser amount of fiber. Now, this in combination with our sedentary lifestyle has caused a dramatic increase in obesity over the last 2-3 decades. And obviously, associated with obesity, there's been an increase in diabetes and other related disorders. Now, when we talk about weight loss in a patient who has diabetes and obesity, the first step we need to do is to reduce the calorie intake. Now, in any weight loss program, almost 2/3 of the weight loss is achieved because of calorie restriction. That's something which is very, very important. The patient needs to understand that unless and until there is some amount of reduction in his food intake, he or she is not going to achieve whatever weight loss they are trying to achieve. So what we do in practice is we ask the patient, we assess the patient's calorie intake, how much they're eating on an average, and then we give a deficit of on average about 500 calories from that level. Now, if you're able to do this over a period of, let's say, a month, you can expect anywhere between 1.5 to 2 kgs of weight loss, provided the patient sticks to that pattern that has been advised to him. Now, and how you do this is by trying to control your portion size. Whether you're eating carbs, whether you're eating fat, all these need to be reduced. Now, we are going to talk about the role of fiber in the next few minutes. It's very, very important that the patient tries to consume most of the carbs in form of complex carbohydrates. So we're talking about increased consumption of whole grains, legumes, vegetables, fruits, nuts, and trying to cut down on sugary stuff, sweets, fast food, junk food. All these are highly calorie dense. So what happens is even a small portion size would give you a lot of energy and will contribute to your weight loss. And obviously, the second important thing would be to reduce your fat intake. Now, what we tell most patients, the simplest way of reducing your fat intake is to try to eliminate anything which is visibly oily in your food. So we're talking about all your deep fried stuff. We are talking about most of the fast food. We're talking about junk food and things like that. If you're having excess amount of non-vegetarian food, probably you need to moderate that also. So all these factors play a very important role. So the first step would be reduce your calorie intake. And then obviously Dr. Balaji was talking about physical activity, which is so important, at least 30 minutes on average, trying to do it at least 5 to 6 days in a week. Now, if somebody wants to achieve weight loss, probably you need to go a little beyond 30 minutes. Maybe whatever extra you can do would definitely go a long way in helping you lose that little weight. But the most important thing is there has to be some amount of calorie restriction from whatever level you're eating. It's very, very difficult to lose weight without restricting your food intake just based on exercise alone. So that's what I would like to stress. And there is a very important role for the fiber in the diet, basically because if your fiber content is more, it gives you more satiety, helps you curb those hunger pangs, and indirectly also helps control your blood sugar, especially the post-meal values, has some impact on the blood cholesterol levels. So all those factors make a very important, I would say, it contribute importantly in helping you lose a little weight. Thank you.
Thank you so much, doctor, for throwing light on how even a small bite of a very, very calorie-filled food could, make an impact and, really affect the health adversely. Which brings me to my next point, which I would like to direct to Dr. Soumya SL. Ma'am, what improvements could be done in the lifestyle management and can be done during, pre-diabetes particularly? And how can we change the lifestyle and diet in a way that will be healthy?
Thank you for that question. So the question is about the lifestyle modification in pre-diabetes patient. So what is pre-diabetes? Pre-diabetes means your blood sugar levels are above the normal, but not high enough to be called as diabetes. So whether we can, so what is the risk of this pre-diabetes? So pre-diabetes people are at high risk of developing diabetes at a later time. So can we stop the progression of diabetes? Can we stop the development of diabetes in those patients with pre-diabetes? The answer is definitely yes. So how can we stop the development of diabetes in a patient with pre-diabetes? So previous studies has shown that achieving and maintaining a weight loss of at least 7% can reduce the risk of developing diabetes in pre-diabetic patient by at least 58%. So the main goal is weight loss. So how can we achieve the weight loss? So it is already discussed. So I'll again brief that. So the main aspects of weight loss is a lifestyle modification, that is change in the diet and change in increase in physical activity. So in diet, so like every patient is unique, so a universal diet pattern is not there for every patient. So we have to consult a dietitian and we have to get a customized diet plan for each patient based on the patient's eating pattern, physical activity, lifestyle, and considering all these factors, we have to get a customized diet plan for each patient. And this diet should be carbohydrate restricted, calorie deficient diet. As Anish sir already said, at least 500 kilocalories of calorie deficiency is required for achieving and maintaining weight loss. And the carbohydrate source should be a complex carbohydrate. We have to avoid the use of this refined carbohydrate and we have to use more complex carbohydrates and adequate protein, and we have to use the healthy fats like unsaturated and monounsaturated and polyunsaturated fats. And here comes the importance of fibers. Fibers have an important role in the prevention of diabetes in those with pre-diabetes and for weight loss. So what are the foods that is rich in these fibers, these whole grains, vegetables and fruits like berries, apple and orange, all these are rich in fibers. So by including these fibers in our diet, that can help in weight management and that can also reduce the glycemic exertions after the meal. And that is also helpful in reducing the blood pressure and cholesterol. So if we are starting a meal with a fiber-rich diet like a salad or a soup, so that can also that can enhance our satiety, and so our portion size also will be less if we are starting our meal with a fiber source. And about the physical activity, like Balaji sir already said, at least 150 minutes of regular physical activity per week is recommended. So by this diet modification and exercise, we can reduce the weight and thereby we can prevent the progression of diabetes in those with pre-diabetes.
Thank you. Thank you so much, ma'am, for throwing light on how like starting a meal, with a dietary fiber-filled food could make a lot of difference. And of course, we're going to discuss on, dietary fiber as well. I would like to ask my next question to Dr. Naveen Gupta. So many people have this thing which is now very, very common, which is called borderline diabetes. Like, how can the early detection and precautions be taken in such a case? So, I request you to unmute yourself.
So, thank you, Dhoni, for the question, because this is really, really very important. That what is the borderline diabetes? As already talked by Dr. Amit and Dr. Balaji, that we are in a phase like people don't recognize what are the signs and symptoms, first and foremost, of the diabetes. Okay, they land up into high blood sugar levels, but they don't show up. So first of all, they should recognize like what is borderline diabetes, is their blood sugar level. So for that, like they should have their regular health checkup at least once a year. Okay, they should go for it at least for like fasting and post-prandial blood sugar levels, including HbA1c, at least once a year, once they are into their 25 and 30s. And they should also look out for symptoms where they are feeling like time and again hungry. Even if they have their proper meal, again in between the meal, they are again feeling hungry, they are feeling more thirsty, but they have a desire for like again and again going for the urine. Okay, so this is something, and why borderline diabetes? Because if we are able to modify our lifestyle, again, like I already talked about, like stoppage of smoking, including some exercise at least 30 minutes. Out of which, like they can go for 15 to 20 minutes of aerobics and 10 minutes of resistance. Because why resistance exercise are also important? Because it is the muscle who are mainly uptaking the glucose, which is increasing in the blood. And also, I have already talked about by Dr. Balaji that the central obesity is something and it causes insulin resistance. So when the muscles are not there, the fat is increasing. So the uptake of glucose by the cells of the body is somewhat diminished, and that is what the glucose keeps on increasing and not utilized in the blood. Now, once the glucose is not utilized, okay, the cells of the body send signals to the brain that I am hungry. Okay, I need food. And that is why people then have cravings and tend to eat more and more food. Okay, they already have a high blood sugar level, but this becomes a vicious cycle, okay, in which like they don't know that already they are landing into a phase of high blood sugar level. Okay, there are no such visible signs and symptoms that something, a sneezing or a fever or something will develop, but they will continue landing into that phase. And once their HbA1c increases like more than 6.4, they land into a phase of diabetics. And sometimes later on, then they experience sudden weight loss because the muscles are losing. The body starts breaking down the protein and they start losing their muscles. Okay, so this becomes very, very important and already talked about by Dr. Somia that of like nutrition management, drugs are important definitely, okay, but your lifestyle modifications like addition of healthy food. Now, healthy foods definitely, the complex carbohydrates are very, very important, okay, because they are not broken down very quickly. Secondly, talked about by Dr. Ashish that the glycemic load is very important, like not eating a large meal in one go. Because even if you eat a low glycemic index food, but you eat a large quantity, the blood sugar, because the time required for the digestion is same, okay, then the blood sugar level increases and the body, because of insulin resistance, is not able to utilize that large amount of glucose in one go. Okay, so that is why the load, glycemic load, the amount of food also becomes important. That is why it has been saying in a diabetes that eat small meals but frequently. Okay, so this becomes very important, and identification of borderline diabetes, that is why it becomes very important that you've identified quickly. Okay, you can adapt some lifestyle modifications, do some exercises, okay, and lifestyle modification, again, I would like to highlight the importance of fiber. Now, there are two things in fiber. A lot of people feel that eating salads and everything is okay. No, but there are two kinds of fiber, which is one is insoluble fiber, okay, and one is soluble fiber. Now, insoluble fiber definitely like helps in somewhat filling your tummy, okay, but that is only like helping in relieving your constipation because at that it bulks to your stool. Okay, secondly, the soluble fibers are ones which dissolve in water. They are still not digested in the small intestine. Okay, but they have like three-pronged benefits. One is they help in release of the incretin hormones, which are like satiety hormones from the GI tract, okay, which help you feel fuller. They send signals to the brain, no, my tummy is fuller, I don't need food right now. The people tend to eat less. Secondly, they combine with the food and help in slow release of glucose so that the glucose which is supposed to be absorbed in upper part of the intestine in duodenum itself, okay, it is absorbing slowly. There is slow release of glucose and it gets absorbed in the entire duration of the intestine. Thirdly, when this fiber, it reaches the larger intestine, the larger gut, okay, there are bacteria in the gut, the good bacteria, which ferment this soluble fiber. Okay, so they are not digesting the fiber, they are fermenting it and converting into small chain fatty acids, which when it gets absorbed into the blood, okay, they inhibit the cholesterol synthesizing enzyme of the liver and helping lowering of the lipid levels as well. So you see that this soluble fiber has multiple benefits. Okay, I'm not saying that insoluble fibers are not okay. Yes, they are okay. They will help you in relieving constipation as well. But addition of soluble fiber, now the question arises from where you can take soluble fiber. Okay, soluble fiber can be taken from foods like fruits, like oats. Okay, oatmeal is a very good source of soluble fiber. Apple is a very good source of soluble fiber. Pears are a very good source of soluble fiber. So most of the foods and legumes are very good source of soluble fiber, but you need to know like which food has more soluble fiber. And if you don't have like time, because today there's a fast-paced lifestyle, okay, people don't have time, they have a lot of work, they have a lot of stress. Okay, so there are supplements available in the market which have soluble fiber. Okay, whenever you're going and choosing or asking your doctor or the doctor is prescribing, we should know that which product has good amount of soluble fiber, a good amount of protein, like Dr. Ali said that it should have less fat, okay, and some vital nutrients which help in giving that soluble fiber which is lacking in the diet of people right now today, and that is a major cause of concern. And guidelines also recommend that there are 25 to 40 grams of soluble fiber can be taken by a person, and that is what which will benefit them and helping in lowering of the weight, okay, control of the lipid levels, helping lowering of their blood sugar levels, lowering of the insulin spikes, and thus benefit them in the longer run and help in management of the diabetes. Diabetes cannot be treated as such in one go. It's not a 5-day course, but it has to be slow and gradual approach, Dr. Balaji talked about, the gradual weight loss, okay, targeting your height, something, and that should be a target that every month you should have that much amount of a goal of weight loss by incorporating all these changes. No one strategy works, but a combined strategy will definitely benefit all the diabetic patients or the borderline patients, definitely.
So much, doctor. Thank you for throwing light on how, small portions can be more beneficial rather than big portions, large portions when it comes to, having healthy eating habits. And yes, taking to such a, intricate discussion of dietary fiber. Thank you so much for throwing light on such important aspects of dietary fiber, which leads me to the similar question, which I would like to ask Dr. Amit Kumar De. So, as we have discussed, and this point has been come across many times in this panel discussion so far, the dietary fiber need and its importance is coming out, loud in the discussion so far. So why is it so important to include dietary fiber in the meal, and how can we ensure the same regularly?
Yeah, thank you very much for this question. But I think a large part of it has already been beautifully covered by Dr. Naveen and also by some of our previous panelists. So start with a quick summarization of how the diabetes diet should be. Diabetes diet is not a single pattern of diet. That's very important. While we stress on the fact that there must be a calorie restricted diet, so restriction of calories is very important. Sometimes we have patients who are very ambitious in trying out the very low calorie diet or very low carbohydrate diet. The diet must be a sustainable diet. That is most important. So it should be a low carbohydrate diet that should be around roughly between 1300 to 1500 kilocalorie per day, or it can be gradually titrated. And it should have a balanced portion of carbs, proteins, fats, and oils. What's most important is to customize your diet. That's a very important point I would like to make here. Sometimes when patients visit us, they ask for a dietary plan or a dietary chart. what we encourage them is to meet the nutritionist and get their diet plan customized, because it is a plan that they would be following 365 days a year. So no single diet plan would be enough. They should be given adequate menu plan options. Now, coming to the need of dietary fibers, I think that has already been highlighted, and there is a need of dietary fibers in our diet. But at the same time, I would also like to mention that, by habit, our Indian patients, they usually have a habit of consuming adequate, some amount of fibers in their diet from the natural sources. So as Dr. Naveen said, that there is always a requirement of 25 to 40 grams of dietary fibers. And we have the two, like the soluble fibers, which predominantly delays the gastric emptying. And that is very, very important in diabetic patients, because it helps to adjust the glycemic curves, especially the postprandial glycemic surges. So that's where it actually helps out. And also it gives them a sense of fullness, so the calorie restriction can actually be worked out in them. Plus you have the insoluble fibers which comes, and that also acts as the fiber, and it helps in relieving constipation. But there is also a word of caution I would like to mention here, that introduction of dietary fibers must be done very gradually, because it can lead to bloating. So too much intake of dietary fibers at a quick short duration of time might just lead to dyspepsia, bloating and belching and these kind of symptoms. So gradual introduction is very, very important. So that is one thing that our patients must take it into note. The other important part about the diet, that it should be a colorful diet. Now we know fibers can be found naturally from whole grains, and consume fruits and legumes and millets. All these contains adequate natural dietary fibers. So your platter must be looking colorful. It should be a rainbow of colored fruits and vegetables that you must be consuming, so that you are not only getting a balanced diet, but you're also getting to enjoy a colorful meal.
Thank you so much, sir. Thank you for explaining us the importance of dietary fiber. And all the viewers, it's a very important and cautious step that we need to take, that not to take an extreme step when it comes to introducing ourselves to dietary fiber and taking some extreme steps in consuming it on a regular basis, and taking it very gradually and so slowly, as doctor suggested. My next question, I would like to present it to Dr. Balaji Jagan Mohan. So one very important thing along with diet is hunger pangs. Like, studies have observed very closely that individuals with diabetes experience severe hunger pangs. So how can we control these hunger pangs easily? Because it's very difficult to curb it.
So when we talk about hunger pangs, especially in a diabetic individual, these hunger pangs can be either a sign of high sugar, what we call hyperglycemia, or it can be a sign of low sugar, what we call hypoglycemia. Now, as we've discussed previously, the blood sugars have to be kept in a normal range. Now, suppose that individual is having hyperglycemia, the higher range, then the tissues are not utilizing the glucose. All the glucose is basically in the blood itself. So it is circulating in the blood. There is no energy for the tissues. So automatically it will send a distress signal to the brain, and that is where you have that feeling of hunger. So high blood sugar is definitely a sign of hunger. Similarly, low blood sugar. So for example, certain medications that are used to treat diabetes, or even insulin for that instance. So that also can cause low sugar. Or if a person is consuming a lesser quantity of meal, or if that person is exercising a lot, or if there is a gap, there is too much of a delay in the consumption of their food, all this can trigger a hypoglycemia or low blood sugar. So there as well, the individual can have these hunger pangs. So hunger pang is nothing but it's a distress signal either in the presence of high or low blood sugar. But the end result is that the tissues like the skeletal muscle, the adipocyte, and the liver, they're not getting enough amount of glucose, which is then converted to energy. So what are the things that we need to do to prevent the hunger pangs? So as pointed out by my colleague Dr. Amit and all the other panelists, we need to consume a diet that is high in fiber, low in calories, and low in glycemic index and glycemic load. Now, fiber, as rightly pointed out, it leads to early satiety because it reduces the digestion of the food. And the other property of fiber is also it prevents the postprandial excursion in blood sugar. So there will not be a sudden rise in the blood sugars after a meal. Fibers are also known to reduce the body weight. It reduces the cholesterol. It can even, reduce the risk of cancer and heart disease, as pointed out in some of the other studies. So by and large, if we have to reduce the hunger pangs, we have to be watchful of hypo and hypoglycemia, especially in a diabetic individual. And we need to consume a diet which is rich in fibers, low in glycemic index, and ensure that that individual has these meals on a regular basis. It's not transient in nature, so that we can prevent some of these hunger pangs.
Thank you so much, Doctor. Thank you. Moving on to our next question, which I would like to ask Dr. Anish Bell. So diabetes being a lifestyle disease, what are the must-haves on a healthy, diabetes plate that we can introduce as a change in our food habits for both vegetarian and non-vegetarian diets?
Thank you, Dhwani. Now, when we talk about management of diabetes, a lot of patients feel that if they're having medications or they're on insulin, probably they don't need to pay too much of attention to their lifestyle. What one should understand is that lifestyle modification, whether it's diet control or exercise, is as important as consuming medications or taking insulin. Now, the concept that we try to promote to patients who have diabetes as far as healthy eating is concerned is to have a balanced approach. So towards this concept, there's this idea what's called the healthy eating plate. So essentially what it means is that not only what you are eating is important, how much you're eating, what's the portion size, that's also equally important. As Dr. Naveen rightly said, that many times, people eat large quantities of certain food. So the food may be low in glycemic index, but the load is so heavy that it contributes to hyperglycemia. So what you eat is important, but how much you eat is also equally important. And that's where this healthy plate concept is really helpful. So to just tell you briefly, what we tell patients is to have a plate which is probably about 9 inches in diameter and divided into 4 parts. So 2 parts, that is half of the plate, should be filled with lots of non-starchy veggies and fruits. As Dr. Amit was rightly talking about, you need to have a diet which is very colorful. So you need to have lots of different kinds of fruits and vegetables, which kind of makes it interesting, makes it very appealing. And, you eat it in spite of the fact that you're eating a lot of healthy options because you're eating fruits and vegetables in a large portion. So half of a plate or 2 parts of a plate should be covered with lots of non-starchy vegetables and fruits, and 1/4 should be covered with complex carbohydrates. We're talking about things like whole wheat atta preparation. We're talking about broken wheat, dalia. We're talking about millets. So all these are very good options which can occupy 1/4 of the plate. The remaining 1/4 is proteins. So if you are a vegetarian, you can choose things like milk, paneer, soya bean, maybe tofu if you have an inkling for those kind of things. You can also have lots of dal. These are all rich sources of protein for a vegetarian person. Now, if somebody is fond of eating non-vegetarian food, probably you can include egg white. You can include lean cuts of meat rather than having meat which is a lot of fat in. So probably white meat with lean cuts is what would be a good idea. So this is what is the concept of healthy plate, wherein most part of it is occupied by veggies and fruits, and a very small portion is occupied by things like which are more calories, I think. So that is about healthy plate concept, which we try to promote to all our patients who have diabetes.
Thank you so much for distinguishing how a plate has to be filled with what ingredients, what items. All the viewers do take notes of these very important pointers as our doctors are mentioning, because this is going to make a ton of difference in your lifestyle as well as in people who are suffering from this disease. I would like to ask the next question to Dr. Sonia SL. Ma'am, what is diabetes reversal and what all we need to know about it?
Thank you for that question. So diabetes has long been considered an incurable disease. So now but we have enough evidence to suggest that diabetes, at least in a subset of patients, mainly young patients, young obese patients, diabetes, who are requiring less number of anti-diabetic medication for their hypoglycemia. So in that subset of patients, diabetes reversal is possible. But that may not be possible in elderly, lean patients with long duration of diabetes or complications of diabetes and who are recurring in their glycemic control. In that subgroup, diabetes may not be possible. So what is the basis of this diabetes reversal? It can be achieved by substantial weight loss. So this weight loss can be achieved by, as we already discussed, low calorie diet, low carbohydrate diet, or in patients with morbid obesity, sometimes may require bariatric surgery for this substantial weight loss. So the definition of this definition reversal is after a substantial weight loss, medication to maintain an HbA1c of less than 6.5 and a fasting should be 126 milligram per deciliter on 2 occasions, that is at least 6 months apart. Is met, it can be considered as diabetes reversal. For diabetes reversal, what we have to do is like a substantial weight loss that has to be achieved with dietary restriction, increased physical activity. Sometimes this weight loss is easy, but that maintaining that weight loss is more difficult. So to prolong that diabetes reversal, to keep the patient has to maintain their weight loss. So that is more difficult. For that, they have to continue with their lifestyle modifications.
Thank you. Thank you so much for throwing light on this, ma'am. Yes, I guess. Moving on. Thank you so much, ma'am, for answering that query. My next question I would like to direct to Dr. Naveen Gupta. So there are a lot of products out there in the market for weight management and controlling diabetes. So how can we evaluate the best product to be consumed?
Again, thank you, Dhoni. This is definitely a very important question. Okay, because there are a lot of products, as rightly said by you, and also talked about Dr. Anish, that you should include like half a plate with, first of all, like going with the natural things, whatever is available in your diet. Definitely on a daily basis, it becomes very, very difficult to include like half a plate of all non-starchy vegetable, fruits and everything. I don't know, because people go to office whether they will carry that much amount to the office or not. It becomes really, really difficult. Even when you are at home, every day, sometimes it is not possible, okay, to include. So people like lack in their knowledge, like what to eat every day, what not to eat every day. Now that is why, and they have a more like kind of refined carbohydrate diet rather than, as talked about by Dr. Amit, that we should include complex carbohydrates in a diet. Now, when they land up into diabetes, borderline diabetes, or a pre-diabetes, now this is where, as already talked about by all the panelists earlier, that lifestyle modification, physical activity. Now they are not able to comply with these suggestions and guidelines on a normal day-to-day basis, they have to be given like a supplement, which are definitely available in the market. So I'll talk about 2 or 3 things. Definitely protein has to be good in that supplement, which is of high quality. Okay, because then that is where like you will have all the essential amino acids in that protein. It should have like low quantities of fat, but good quantity. Like talked about Dr. Soumya about monounsaturated fatty acids and a polyunsaturated fatty acid fat should be there. Okay, the carbohydrate content should be around 45% percentage, which is being talked about by AMDR guidelines as well. Okay, but the most important thing that we don't look at is as the fiber content. Now, again, coming on to, we can have insoluble fibers definitely in a diet like a salad and a lot of things related to vegetables, but we forget about the soluble fibers from where it is coming. So, if you're having like soluble fiber in those supplements, like commercially available fibers, we generally have a single soluble fiber which is called as nutriose. Okay, there are some supplements which are available with a dual blend of supplements, which is nutriose and fibersol. I'd like to throw about some light on these two kind of fibers specifically because they are the most extensive studied fibers, like, and there are a lot of studies published on them. Nutriose is one viscous soluble fiber which delays gastric emptying. Okay, and it helps in release of the satiety hormones as well. Whereas fibersol, if it is present in that supplement itself, it also helps in release of the satiety hormone, and when it encapsulates the food, okay, it helps in slow release of glucose in the entire portion of the small intestine. So just remember one thing, that the digestion and absorption happens in small intestine, okay, of the nutrients like carbohydrates, proteins, and fats. Okay, it does not happen in large intestine. So we have to choose that supplement which have these like commercially available soluble dietary fiber, soluble fiber in it. Secondly, definitely the protein has to be adequate, around 20 grams of protein like per 100 grams if that product is having. That is considered to be a good quality like a supplement itself. One most important thing like which as a healthcare provider, which I was also not knowing previously, and when we did an extensive research, and our R&D department also did an extensive research, found that like a lot of products, they have maltodextrin in it as well. Now, people know that maltodextrin is a tasteless thing. It is only added to the product like for adding, increasing bulk of things, but that is counted in the carbohydrate content because maltodextrin is nothing but refined carbs. Okay, but studies have also shown that this refined starch, maltodextrin, has a higher glycemic index than table sugar. Okay, table sugar has a glycemic index of around 65, but maltodextrin glycemic index can range from 85 to 140, depending on the refinement of this carb. Okay, the other advantages why manufacturers do add this maltodextrin is because, firstly, I told about that it increases the bulk of the product. Secondly, it helps in improving the stability of the product also so that it increases shelf life. Now coming back onto diabetes. Just remember that diabetics, they're already experiencing a high glycemic index, a high blood sugar levels and everything. And we are targeting the products which should have a low glycemic index. Okay, so that a sudden rise in blood sugar level should not happen. Okay, now if we are adding maltodextrin and choosing a product which has this component in it, in a diabetic patient specifically, we are doing injustice to that patient because maltodextrin has a higher glycemic index than table sugar. Okay, definitely that product should not have table sugar or added sugar. Okay, but we should also choose a supplement which should not have this maltodextrin because it is dangerous for these patients because then the spike will come and there will be an insulin spike also, and you know that insulin spikes are also not good because whatever extra amount of glucose is present in the body and the spike is there which the body is not able to utilize, that goes and again gets deposited into adipose tissue as fat, which increases the fat content of the body and increases more and more insulin resistance. So again, coming back to a product for nutritional management of diabetes, apart from your natural daily diet, which you can incorporate, or obviously, if you can do that on a daily basis, that is perfectly fine. No need of any nutrition supplement. But if you feel like, and a doctor feels like that it is not getting, like the patient is not able to manage or not able to incorporate those healthy changes in their daily plate, a healthy plate, then addition of that nutritional supplement will help them choosing a supplement which has a dual blend kind of these nutrients and fibersol, which has a dual mechanism of action. Again, in my previously, like talked about that, yes, this fiber helps in 3 ways. It helps in improving the satiety so that those hunger pangs are not there. So secondly, it helps in like a slow release of glucose, reduction of glucose spikes and insulin spikes, because you will feel less hungry in between the meals. So it helps in weight management as well. And the third benefit, like when it gets fermented in the large intestine by good bacteria, which is available in your gut, so it releases small chain fatty acids, which by reflex mechanism helps in lowering of your lipid levels, also stop the cholesterol synthesizing enzymes of the liver, thus helping you with a multiple benefits and multiple approaches. So this is, I would definitely recommend that we all as healthcare providers, doctors, and even the patients like who are coming to you should have these things: fiber, protein, and no added sugar, no maltodextrin they should look for.
Thank you so much for throwing light on those very, very valuable points, sir. Thank you. And with that, we have come to the end of the panel discussion. Thank you so much, all the doctors, for that really, really invigorating session. But we are still, going on with the question answer segment that we had promised earlier. Doctors, we have received a lot of interesting queries and questions from the audience. So what will happen now is I'll just read out those questions from the audience to you, and whoever would like to throw light and solve this query that the audience has presented to us could do so. Yes, I'll be starting with the first question. We have received a question asking, my mother has diabetes, but I haven't been diagnosed with any symptoms yet. Is diabetes hereditary?
Dhwani, I'll take that question. Yes, diabetes has a very strong hereditary component to it. If your parents have diabetes, you are at risk of getting diabetes. And on average, I would say that if one parent is a diabetic, the risk could be anywhere about 10 to 15%. But if both parents have diabetes, the risk can go as high as 60 to 70%. Now, you cannot change your genes, but definitely you can modify your lifestyle. So if you have a family history of diabetes and you don't want to become a diabetic in near future, the best thing is to maintain a healthy weight. See to it that you're doing physical activities on a regular basis, even if your sugar values are normal. And you should probably follow healthy eating pattern so that you don't put on weight. Now, generally, it is recommended that in Indian context, starting at the age of 35 years, you should get a sugar tested once in a year, even if you don't have diabetes, just to be sure that you slowly don't develop diabetes, because diabetes is a silent disease. Many a times, if you wait for the symptoms to develop, probably too late. So we try to pick it up early. So you should do a routine screening once in a year, starting at the age of 35 years. Thank you.
So much, sir. Thank you. The next question that we have received is, what are the serious repercussions of diabetes if it goes unchecked?
So can I take that?
Yes.
Yeah, so diabetes, if you see, essentially it affects almost all the organs, but there are two things that an individual has to keep in mind. We call that the micro and macrovascular complication. That means the small vessel and the large vessel disease. So the eye, the feet, and the kidney, what we call microvascular complications, they're called as retinopathy, nephropathy, and neuropathy. So every type 2 diabetic individual should get themselves screened or checked for these complications right at the time of getting diagnosed with diabetes itself. And any type 1 patient should get screened for these complications after 5 years of getting diagnosed. Now, this is about microvascular. Then you have the macrovascular complications, what we call large vessel disease. So the brain, the heart, and the blood vessels of the feet, what we call it as cerebrovascular disease or stroke, heart disease, or maybe myocardial infarction in medical terms, and peripheral arterial disease, where the occlusion can occur in any of these blood vessels, either in the brain, the heart, or in the blood vessels of the feet. So these are the two main, complications that every diabetic individual, especially a type 2, should get it screened at regular intervals. Apart from this, there are other complications also that a diabetic can develop. So, for example, dental infections like gingivitis, periodontitis, caries are very common in a diabetic individual. Some of them can get something called frozen shoulder or periarthritis of shoulder. That again is very commonly seen in our practice. Apart from that, any infections are very common in diabetics. So, for example, any urinary tract infections, pneumonia, skin infections, fungal infections, all these infections are very common in diabetics. And there is also feet ulceration. So, there is a small ulcer or a wound that can develop in the feet, what we call diabetic foot ulcer. And that generally occurs in patients who are long standing, uncontrolled, they have neuropathy or peripheral arterial disease. So, again, diabetic foot ulcer is something that people have to be watchful about. But, like I said, any organ can get affected because of diabetes, but the micro and macrovascular are in particular the most important that they have to screen at regular intervals.
So much, doctor, for answering that.
Like to add
Thank you.
one more thing here.
Moving forward, there is another question which is on high fiber diet. The audience is asking, how is high fiber diet helpful in managing diabetes?
So can I take
We've
this?
discussed this point very closely, but still, there is one query. Yes, sir. Please, sir.
Okay. So Dhoni has already said like a high fiber diet definitely should include both insoluble and soluble fiber. Like generally, like that is like where I'm not saying that people are like uneducated or something, but generally they are not aware about this. What is insoluble and soluble fiber? Okay, just to make it clear for the audiences that insoluble fiber are the ones which does not get digested in the small intestine, okay, or large intestine at all, and they get passed off as it is when it is eaten because we don't have enzymes to digest in the gut, okay, like the animals do have. Okay, they're definitely these like kind of insoluble fibers, the cell walls, they have a lot of proteins, and that is why we have seen like animals, they only eat these grass and vegetables and everything and they get bigger. But we as humans don't have those enzymes to digest these kind of any carbohydrate which is not digested in the small intestine is called as fiber. Now the another definition is insoluble and soluble. Insoluble means when this fiber gets dissolved with water and forms a mucilage or a mucus-like substance, that is called as soluble fiber. When it does not mixes with water and does not dissolve in water, then it causes insoluble fiber. So insoluble fiber passes as it is in the gut, it adds bulk and it helps in release of your constipation. Okay. Now soluble fiber, I have already told you that it has multiple benefits, and that is why high fiber diet. The general recommendation I already spoke about, that the guidelines say it should be around 25 to 40 grams of soluble fiber daily in your diet. The guidelines are for soluble fiber, not for insoluble fiber. You can have more of insoluble fiber as well. So that is why this soluble fiber is more important, because again, it helps in release of the satiety hormone, so that you don't feel hungry. It helps in reduction of your blood glucose spike and insulin spike, and it helps in your weight management and lowering of your lipid levels as well. That is why it helps by multiple approaches in management of your diabetes, and that is why a high fiber diet is talk of the town, and there are a lot of studies and papers published. Recently in May, the Diabetes Federation of India released a paper on role of high fiber in the dietary management of diabetes. So people can go on the internet and it's a free access article. They can get it there. It has like mentioned a lot of foodstuffs which has good amount of fiber, soluble fiber, which will benefit them. And the supplements, definitely they are already available in the market. So definitely I would request that you should reach out to your doctor first before taking any nutrition supplement, because they are the ones who can guide you based on your diet pattern. Okay, when you are having a large breakfast or a small like lunch or a larger dinner, according to the time of or pattern of your meals, they will prescribe you which time, best time of the day is when you can have that nutrition supplement, and then incorporate and get better and better in improving your or your managing your diabetes.
Thank you so much, doctor, for answering that. Thank you. The next question we've received is a very, very commonly asked questions also on this disease. The audience asking, how frequently should one get tested?
If it's
Yes, sir.
this question, yeah. This is a very common question, and I think it's important that we, sort of highlight this patient. So, frequent monitoring is the cornerstone in controlling your diabetes. And in monitoring, you predominantly need to do your lab tests, your lab workup. At the same time, it also includes the self-monitoring of the blood glucose that you can frequently do at home using simple tools like a meter. Now, let's first talk about the lab testing. So when you talk about your lab parameters, you're looking at the fasting blood glucose, your postprandial blood glucose, and also glycosylated hemoglobin. That should be done at least once every 3 months. At the same time, it's also very important that while you're doing this parameter check, you're also visiting your doctor once every 3 months for monitoring and also their guidance on titrating the doses of your medications. Even if your blood glucose levels are under good control, it's still important to meet your doctor once every 3 months. Titration of the medication is very, very important. While we've been talking about the diet and the low calorie diet, optimization of treatment is very important. So at one point of time and at every point of time, you want maximum lifestyle modifications with diet and exercise and minimal medications, so that you can do away with the side effects of the medications as well. A quick highlight I would like to make on the other parameters that needs to be monitored. So besides your blood sugar levels, your lipids needs to be seen, your kidney function needs to be seen, and your liver function needs to be seen once every 6 months. We also do a protein check in the urine for microalbuminuria. This gives a very important sensitive measure of the kidney function, and it also predicts whether the individual can progress into kidney disease due to diabetes. Other than that, as Dr. Balaji rightly pointed out regarding the micro and the macrovascular complications, so foot examination is very, very important. So examining the feet using various tools that we use in our clinic, like the biotheziometry or the ankle brachial index. You look for peripheral artery disease, you look for diabetic neuropathy. And also the eyes must be screened for diabetic retinopathy. That is very prevalent in diabetic patients, especially in patients who are long-standing diabetes. Beyond 10, 15 years, they're at a very high risk of developing diabetic neuropathy, especially if they have a lot of glycemic variations. So these screenings are very important. And what it does is that it actually helps you in controlling and reducing the complication burden. And by reducing the complication burden, you actually get a better quality of life, and also it cut down on your cost burden. That is very important that everybody must understand. So while it's important to screen for all the complications, routine visits with your doctor and proper titration of your medications along with the proper dietary plan is very important in controlling your diabetes.
Thank you so much, Doctor, for throwing a light on that. I'd like to ask one final question before closing this session. We received a question from the audience where the person is asking, what are the major risk factors for diabetes or pre-diabetes that you recommend the audience to be aware of?
So should I take that one?
Yes.
Yeah, so the risk factors, the most important risk factor is basically obesity. And we've been discussing throughout this session of abdominal and generalized obesity. So any person who's obese who has a BMI that is more than 23. So between 23 to 25, you fall in the obese category. As far as the Asians are concerned, above 25, you're in the overweight category. Above 25, you're in the obese category. So you will have to check annually whether you have either pre-diabetes or diabetes. Apart from that, if you have a family history of diabetes, either your parents or any first degree relatives, second degree relatives, then automatically there is a genetic predisposition for that individual to develop diabetes in the future. Also, people like you have, pregnant women. If they had a family history of diabetes, pregnancy itself is a risk factor to develop diabetes during pregnancy and even later on. So if you've had gestational diabetes, pregnancy, diabetes during pregnancy, then you'll have to screen for diabetes in the future. Also, if you have other comorbid conditions like hypertension, you have high lipid levels, if you consume a diet that is, very high in glycemic index, high in calories and junk food, or if you're leading a very sedentary lifestyle, you're not exercising as much, if your stress levels are high. Nowadays we see that stress is one of the most important risk factor for people to get diabetes. So if you have either familial or occupational stress, then that automatically constitutes as a risk factor to screen for type 2 diabetes at regular intervals. So these are all some of the risk factors that can lead to the development of type 2 diabetes, what I'm talking about, which is a lifestyle disease. So screen for it, as Dr. Anish mentioned, if you're about the age of 35, you have your health checkups that are done by the company, or you can even go to any clinic, get a random blood sugar tested. Always remember, I just want to tell the last sentence. Most people with pre-diabetes and diabetes, 60 to 70% are asymptomatic. They will develop symptoms only if the blood sugars are very high. So if the blood sugars cross 250 to 300, then only you'll get symptoms. We have seen patients who come with up to 250 completely asymptomatic. About 250, then they might have increased thirst, urination, weight loss, infections. But otherwise, 60 to 70% are asymptomatic. So if you have all these risk factors that I just mentioned, then kindly get your self-screen for type 2 diabetes.
Thank you, doctor. Thank you for answering that. And thank you so much, doctors, for answering all these very intricate queries that we received from the audience. And thank you so much, audience, for sending in these questions so we could have such a very informative and invigorating session. And with that said, all the viewers, once again, we have highlighted a lot of points during this panel discussion, taking from, what are the risk factors, what is the importance of dietary fiber in the food, and what is the lifestyle management changes that we could have, and varied points that we have put across. So it's a kind request to all the viewers to take note of this, so it could be more beneficial and could get your life more healthy, this perspective. And with that, let me tell you, this is all for today. Thank you all for attending today's webinar. We encourage you to connect with us on social media to let us know your views on this session. Do share it with your friends and family members who might have missed this insightful session and discussion by esteemed doctors. And I've already said that it's a very important discussion that we had. So do share it with your friends and family members whom you think would benefit from it. And all you have to do is also visit our Facebook page for the live stream. So once again, I thank all the doctors who have given their precious time to us and shared some very, very important takeaways. Thank you so much, doctors. Thank you. And the viewers, if you have any additional queries or questions, you can contact us on our Facebook page, and we will be more than happy to help you. Once again, stay tuned with us for more such discussions. Thank you for your time. Thank you, and have a great day ahead. Thank you.
Thank you.
Thank you.